We are back on Morning Line. Thanks for joining us. Noreen Gibbons is with us along with Meryl Geiger. They both, well, she's going to be an audiologist, a doctor of audiologist. And of course, Noreen is both with Middle Tennessee Audiology. You guys help an awful lot of people with their hearing. And we're going to take calls this morning, 737-7587. We were talking during the break about things you don't want to do with your ear. See these Q-tips? I came in, thought I'd mess with them, and said, oh, before the show I got to clean my ears. They both looked at me like I was crazy. Don't use Q-tips in your ear.
No, do not.
And just don't put essential oils in your ear.
No, do not put essential oils in your ear. It can burn the ear canal. It can actually very much irritate the eardrum, and there's no need for essential oils in your ear.
I would imagine you would recommend, in general, putting nothing in your ear unless prescribed by a doctor for some purpose. Now, sometimes I'll go swimming, and I will get water in my ear. You know how you get that? And then I remember someone said, well, just take a little cap full of alcohol and just pour it in the ear, and all of a sudden you hear this bubbling, and you tilt your head, and that water that wouldn't come out comes out. Why does it do that? What does the alcohol do that loosens it up?
Well, you know, there's probably a little bit of wax or maybe dry skin in the ear canal at that point, and just by putting anything in there, alcohol or peroxide, you're going to loosen that up, and then you turn your head and gravity helps get rid of it.
Oh, okay, so but the alcohol or peroxide doesn't necessarily...
The alcohol could be drying some moisture on the eardrum. So now I do want to say that if people have had any history of ear surgery or eardrum perforations recently, anything like that, you don't want to be putting alcohol in your ear. It could burn, it could hurt, and it could do damage. But for the average person with no ear issues, that's perfectly okay.
But the general rule of thumb, if you just don't put anything in your ear, unless you have an infection, someone gives you drops or something like that. But short of that, do not put anything. Now, what about when you see wax build up or your ear is kind of itching or something like that? There
are some products. There's a product called Miracell that's available that will help with itching ears for people, for example, that wear headsets like you do on the show.
Dried out skin.
Yeah, that sort of thing. That's helpful. There's over-the-counter ear drops. Earwax MD is one that I've found very helpful for people. It helps dissolve the wax, and most of those are available at the drugstores, Walgreens, CVS, those sorts of stores. So.
And by definition, I'm going to ask her this. Is wax bad for your ear? I understand some people have a heavy buildup that can be an issue, but if you're normal, your ear's supposed to have wax,
Correct, yes. So wax is really skin cells and oil that's made by your body. And it's in there for a reason, and so a little bit of wax is healthy, but it becomes a problem when that wax completely fills up your ear, and then that causes hearing problems. So a little wax is normal. A lot of patients we see when we look in, they have a little wax. We don't want to move it.
Don't freak out. It's not dirty. It's not a problem. It's a natural thing.
It is natural, yes.
Let's take a call from Lane. Lane, good morning.
Yeah, good morning. Appreciate your time.
Sure, go ahead, sir.
Yeah, I'm kind of curious, how does your ears affect your equilibrium? Because sometimes I feel like I'm 10 feet tall and walking on a tightrope. And I'm just wondering, is that because of, past injuries? Another quick question is, when you have a concussion, they say you had your bell rung. Does that make any sense? I mean, does that affect your equilibrium?
It certainly can. The first part I want to answer, do you ever feel any spinning sensation or a turning, or is it more of an off balance that you're noticing?
The best way to explain it is when I'm walking up and down stairways, I feel like my feet are too big and I'm on a tightrope, and I've had friends sometimes say I walk bow-legged, and I said, I don't even notice that. So I'm just wondering, if it's equilibrium, because I have been diagnosed with tendonitis, and I'm just wondering, what's coming next.
Well, what you're describing makes me think more of the need to see a neurologist, because what you're describing sounds a little bit less likely to be an inner ear problem and maybe just some evaluation of the general nervous system would be a good idea. They'd want to do some things maybe to check the spine, because of what you're describing. It's not the typical dizziness or disequilibrium that we see in the clinics for audiology purposes anyway. That's more of a spinning sensation when you turn or go to lay down at night, turn over in bed and have a true spinning. The tinnitus, or as you said, tinnitus, both are correct pronunciations of that. That is possibly just a more of a general inner ear issue. How old are you, Lane?
Yeah, I'm 62 years old.
Okay. And when was your head injury? Did you have one recently or in the past?
Well, I used to play high school football, and of course, I used to shoot off guns when I was younger.
Okay. So there could be just some hearing loss and tinnitus related to that, and the disequilibrium is more something else going on. I'd encourage you to talk to your doctor and get it evaluated, though. It's important to take a look at why you're having that sensation.
Now, it may not be in his situation, but folks who have the dizzy spells, is it an inner ear imbalance that can kind of throw you off your game? And like maybe if you have a buildup or something?
There's fluids in the inner ear and the vestibular system, and they're related. If we talked about getting some props, and I want to bring a picture next time, because those systems are very close together, and the 8th cranial nerve is responsible for taking information from that system and sending it on up through the rest of the sensory system. So it is very common to have inner ear problems, meaning hearing loss and tinnitus and dizziness going together. Whether it's the fluids, whether it's something else along the nerve, is always what we have to look at. We have to do some testing to find out which it is.
Usually it can be corrected?
There are some good treatments for balance problems. A lot of times it's physical therapy or different things they can do in an audiology or ENT clinic, depending on what the cause is. There's some different positioning techniques that can be done to help replace the crystals in the inner ear that have basically been knocked loose, as Lane said. That's just
it's just, I can't imagine anyone who's experienced vertigo or equilibrium. I just still remember the classic story of the Russian cosmonaut that went up and whatever at the time, the technology, and he made it back safely, but whatever was happening in zero gravity permanently, and he lived with equilibrium issues and vertigo the rest of his life. And I was thinking, that's got to be about as bad as it gets.
Yeah, there's medications that can be used
Not
to treat
back then,
it.
probably,
Not
but now things have gotten better.
But those medications are central nervous system depressants, so they make you sleepy, and they've got some side effects. You don't want to stay on those for forever. Okay. Like a lot of medications.
But and what causes the equilibrium? I know you said the damage to the crystals, but can it come? Could someone have an issue with that by going on a roller coaster?
Usually not a permanent issue, but they could scuba diving. We were talking a little bit earlier about scuba diving. Because
what about flying?
Flying, sometimes if you have a bad cold or upper respiratory infection, most people, they're going to recover pretty quickly. But if you have something going on in the eustachian tube that might be a little more challenging for that, then you could create some permanent damage, yes.
Wow. All right, let's take a break on that note. When we come back, we're going to talk about cochlear implants and just hearing aids in general, and whether or not there's some amazing ones out there. They can be spendy, and how you decide what's right for you. We'll take more of your calls and continue our conversation with our guests right after this.
The Storm 5